And you see, you got the loosen up. When you finish, you can just close that up, and it's fine because it's still sterile because it's closed. So those are just like from real life skills.
Yeah.
No, that you won't need that because that's only for section. Okay. That's a standard sterile kit. And again, comes with the gloves, which you can grab like that with no gloves. The drape that you're going to put over the patient, that's what you grab, right? Right? Now the drape is the question. You see, you can position to your comfort. If you have a towel, the drape might be handy to put just right here. Variety of the way. Different nurses, they do different way. But the drape, you can unfold, but if you unfold and put on the patient's side, you won't be sterile anymore, right?
You need to keep the towel there or no?
If the patient has, if they don't have it, this is for dressing, for protection. Because you might be doing that, you will be doing only dressing, not section.
Oh,
You see, so the patient does not have any.
Professor, I have a question. If we're doing the dressing, we could still bring in a towel, or
you don't have to. If the patient is clean, because you got the drape.
Okay.
But you know, it's not a critical element. Critical elements are only sterility with certain point, and I will tell you. It's optional how you deal with it. Okay. You see, we got the little container that we got so many things here. Now, I have to put my gloves now. That's going to be a problem again. Okay. Because I have a here string that will go to the trachea. I have a gauze, which sometimes we change only that, so you got some gauze here too. I hope they are already preset for you. You can see that. Look, see that? That's what we're using all the time. I will. Oh, you see?
Oh, yeah.
Because it goes around.
It's easy. Yeah.
It's very easy, and that's what you need to know. So you won't be struggling when you will be doing patient care with that. Okay. So you got that. You got brushes to clean up the tray, right? So now I have a problem because I have to fill up this container with the saline, and another container I have to fill up and say half and half, 50-50. If you miss 1 cc, it does not matter. As long you remember that you cannot put just plain peroxide. Because peroxide is useful, but peroxide kills healthy tissue. So you have to remember, that's why we stopped using peroxide on the wounds. We don't do that anymore. Soap and water is the best treatment. So for the cleaning, because you want to kill some bacteria, we dilute half and half. So now I guess I have to swallow the pride and put the gloves on, right? So now, when I loosen everything up down there, now I'm going to put only one glove again, because I'm too smart for that, you know. Okay. I got one glove. And again, I don't care what you do, as long as you don't mess up. See what I did? See what I did?
Yeah.
It's fine, right? Now, with my sterile glove, I can do that, right? 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 Or I can put even here. That's fine as well. So now, with that non-dominant hand, and I don't have anything, I loosen up, I open again, and I pour the normal saline right here, right? And here, this is good because you practice variety of the techniques. That's going to be half and half, right? And remember, I do not wear gloves, see? But I loosen up, because I'm smart, So I don't have a problem now. Oh,
Rubber.
I might have a problem. No.
No, you don't have.
You see? Half and half.
You don't put
You don't put in the other one?
No.
No.
Another one is plain
Plain
saline.
saline.
Because you don't want, you clean with the peroxide and saline,
Ah.
but you rinse with normal
okay.
saline.
Okay.
So now, I guess that we are ready, and I have to tell you, but later. Because again, when you do that, you don't have to have sterile gloves, but you need to wear clean gloves.
When you take it off.
Take that out. But you know, because I don't have other choice, I guess I will put the sterile glove, because we're gonna have some practice, right? But I'm telling you the choices. So if you're gonna use another choice, oh, be my guest. I will be so proud of you, because I will know that you're thinking. Okay. But look, when I take that out, I'm not sterile anymore, right? You agree with me?
Agree.
So again, this is another one-hand sterile technique. Now, taking that out, you have to rotate gently. You don't have to be forceful, because you see how long is this? And this is real size. And when you will be going in, I will show you, you will be rotating as well. So now what you do with the sterile hand, right? We're starting right here. Because it was some mess, I can play with that. Look, you clean that up. And now when you finish cleaning, bingo, here, right? Second one, I did wrong things here. If you have some more, you just play with that. The under part is not sterile, and don't even bother. You have to be sterile here, up to here, right?
Okay.
The tube, what is inside, because that's outside. All right? Second one, I don't want to cross the field, you know, that's on. So rinsing more, that's up to you. I'm just showing, pretending that everything is clean. Now you rinse with that. You see
got
that?
it.
Yeah, we got enough.
That's a whole mystery. Shake. And now you're going back to the patient. Now you don't have to be sterile. Look what I did.
Okay.
Because I'm right-handed, everything is sterile here. Are you with me?
Yes.
This. But this is not. This is clean only. When you go in, you rinse so you don't have an excess of fluids. Look how I rotate. Because that's the anatomical position of the tray. Okay? Went in, and there is a little click. It's click. You see?
Okay.
Now you take some more. You can take, you're not sterile anymore, so you can take some more normal saline from here, and you will clean outer part. So you will take that outside. This is only clean, you're not sterile anymore. You see what I'm saying? You clean outside. Now we need to change, and sometimes you need to go under. But going under, you can use also some Q-tips and not going inside, but just like here, gently from outside. Everybody with me?
Yeah.
That's all.
Saline water, right?
Same.
Just
Same.
saline
Okay. So now we need to change the string, which is always headache. And now I want to show you that we have a light. We don't use anymore those strings. They're only man-made here.
I don't see anything.
No, because we have a special, Velcro, and you just secure that, and then they are much better. But here you got string. We're gonna deal with string. Always remember, security of the patient. When you do one side, only loosen that from one side, because if you're gonna lose it, take that from both
You
sides.
lose it.
Patient might pop out on you, right? And I take those strings. Again, this is not sterile, this is clean, as long as you secure.
How
Again,
you secure that?
as long as you secure.
Okay.
That's all.
No.
Overhand knock, that's it.
Yeah.
Take that
Long
one
is
out.
secure.
Okay.
Okay, so yeah.
Right? Better or less as long as it's secure. You don't have to be artist to do that.
How far should it be?
One finger maybe?
One finger that you can put inside. You don't want it too loose. You don't want to put too loose. You don't want to put too tight. And you won't be using. And I brought here some Velcro, and she does not have it. Because that's Velcro you put in, and you got just you attach accordingly to the security. Okay. It's not a tricky job, but it's work. And you can be as creative as you want. I don't mind. Some students, they cutting here in the middle and they doing, this is up to you. That's not important. We clean up, we put the dress on, under, right? Two of them. We can take one more, get one more, as long as it's clean. See? And your skill is done. That's all. That's a real skill, and that's a very frequent skill that you will be doing. And patients are very happy because they are clean up everything. And if they are comfortable, you don't have to oxygenate. If they feel that a little shock, you always can undo back them 3 times. But that's actually.
But you don't have to. That's up to you.
They are fine, they are fine. Questions?
No.
Simple, right?
Yeah, that one
Very
is.
simple skills. Now, so basic and important, when you finish your skill, you have to put back and you have to put the bed lower. Now, what you want to do with the Foley catheter? You want to go for break? You want